Hi, I'm Brooke, and on today's Health and Wellness segment, we're coming to you from RHealth here in Philadelphia. And I am speaking today with the CEO of RHealth, Mason Reiner, and also Dr. Stephen Stoll, who's one of the physicians here. Thanks for being here today.
Thanks for having me.
Great, thank you. So my first question is for Mason, and basically I just wanted you to give me an overall idea of the RHealth concept.
Sure. So RHealth is the first direct primary care provider here in Philadelphia. And direct primary care is a growing national movement of employers, unions, individuals, and families partnering directly with primary care physicians to really take control of healthcare cost and quality. Essentially what it is we replace the fee-for-service volume-based payment system for primary care with a very simple, affordable membership model. So for one fixed monthly membership, individuals and families get a true relationship with a personal primary care physician, and that physician serves as really as a home base for comprehensive primary care, preventive care, urgent care, and care coordination among specialists when that's necessary. And really what we're doing is we're empowering that patient-physician relationship and bringing it back to the forefront of medicine, which is really what's critical for helping people stay healthy and then to enable them to conveniently address medical issues when they do get sick.
Now, how much does the membership cost?
Sure. So membership for an individual is $79 per month. For a couple is $150, and for families $250. But we also offer group discounts for employer groups and larger groups. And what's important to emphasize is that's all you pay. There are no co-pays, there are no co-insurance. That gives you unrestricted access to your personal physician with no additional costs.
Dr. Stoll, how did you decide to work for direct primary care?
Sure. So the healthcare system as it stands now is fairly inconvenient for most people. It's one of those things where it's a volume-based service where the doctor has to see as many patients as possible, and the patients only have a few minutes with the doctor, and everyone's rushing and trying to get in, and can I ask you one more question? And it's a whole free-for-all. So there had to be a better way, right? So direct primary care is this good concept where you can basically spend as much time as you want with the doctor, have a private doctor, have a better relationship with the doctor, better overall health outlooks. So I was thinking about it in general. Turns out Mason was thinking about it at the same time, and he was looking for a Center City doctor. I said, why not me? And he said, glad to have you on board, and here we are.
That's great. Mason, what type of employers should consider direct primary care?
So I think that there's really three types of employers that this model makes a tremendous amount of sense for. Number one is if you have an employer that has a self-funded health plan. So they're essentially paying for themselves for all the waste in our healthcare system. You know, unnecessary utilization of emergency rooms, hospitals, specialists, redundant care, all that the employer is ultimately footing the bill for, and frankly the employees are also footing the bill for. So for an employer or a union, frankly, with a self-funded health plan to utilize direct primary care and direct primary care physicians to really be objective quarterbacks for the healthcare system is a great model, and it helps to deliver better care for the plan members and reduce waste in terms of downstream utilization of hospitals, urgent care centers, unnecessary testing, etc. So certainly self-funded health plans, this makes a tremendous amount of sense for. I think number two is those employers who are facing uncertainty around the employer mandate. As the Affordable Care Act employer mandate comes into being next year, so there are employers who are looking for affordable solutions to be compliant with the Affordable Care Act while delivering a good health benefit to their employees. So direct primary care can really serve as a foundation of a smart solution for that issue. And I think number three is employers who are moving towards higher deductible health plans, right, which shift more cost to employees. If they couple that with the direct primary care option on the front end of that benefit, that's a great solution, because then folks have convenient, affordable access to day-to-day routine care through direct primary care, and then they have that high deductible health insurance plan to protect them if they really get sick, so they have, so they don't go bankrupt, frankly.
Okay, that's interesting. Can you tell me what services are included with the membership? I know you went over this a bit, but
Sure.
what entirely is included?
So like I said, it's one fixed monthly membership fee, and that gives you unrestricted access to your personal physician. When it includes same or next day appointments, there's extended hours. You also have cell phone access to the doctor, email, mobile messaging access to the doctor. If it's medically appropriate to conduct a Skype visit, for a follow-up discussion, so you don't actually have to come into the office, you have that kind of access as well. So it's really comprehensive, proactive primary care, and you really get an advocate, somebody who knows you, who you have a relationship with, who you have great access to. That's all included, and there's no additional costs.
That's great. Now, Dr. Stoll, who would you say RHealth works best for in terms of what types of patients?
Sure. So I think that RHealth can work for any number of patients. Number one, just anybody who wants a closer relationship with their physician and wants to be proactive about their medical health. The other thing it can look, the other group of patients it can work for is for patients who are busy, on-the-go people who don't have time to wait in waiting rooms for hours on end. With RHealth, you have 9-minute wait times at most. You have same-day appointments, 30 to 60-minute visits where you can get everything done in one visit without having to come back for more. Busy on-the-go people. Also for corporations, big companies which have a lot of different employees, and they want to make sure that they're healthy for the long term and don't have all these sort of downstream costs from a whole subset of sick workers. I think it's a good way to be proactive about keeping your employees healthy. And in general, it's patients who can't maybe afford insurance plans and they need something in the meantime or even indefinitely to cover them. Patients with high deductible plans who want to make sure that they have a doctor there for them so they don't have to spend everything out of pocket on their deductible. I could go on and on.
Can you give me an example of how the RHealth model helped you improve a patient's care?
Sure. So, for example, we had a patient not too long ago with a big honking abscess. And in any other case, the doctor would have taken a look and said, go to the ER, and the patient would have wandered outside of the office and found himself to the ER and plopped down $100 copay at the ER, and if he had insurance, rack up some insurance bills. If he didn't have insurance, rack up some medical debt, and probably would have been admitted to the hospital, had the abscess drained, been over there for a few days with IV antibiotics, and then sent back out into the wild. The way we handled it is we said, this is an abscess, it needs antibiotics on board as quickly as possible, we need to keep a close eye on it. We called in antibiotics. We followed him closely as he took it. We brought him back, I think, every day or maybe every other day for about a week until we were confident that it was coming down. I got him in with a dermatologist that day. We were able to drain it on an outpatient basis, and I think we saved him probably a week in the hospital and a lot of medical expenses. His wife was very happy. I think they went on a trip to Seattle afterwards.
Wow.
Yeah. I was not invited.
Great to hear. Oh, no,
No.
you weren't invited. Sorry.
I had to stay here.
Can an employer or union save money if they already offer health insurance?
Sure, absolutely. On average, utilizing direct primary care, an employer union can save somewhere between 10 and 50% of their total health care costs. And the way that works, again, would depend upon what type of plan they have. If they have a self-funded plan, so what they're going to be doing is essentially driving a lot more care into highly accessible, highly affordable, fixed-price primary care setting and reducing downstream utilization of expensive ERs, urgent care centers, hospitals, and specialists. And then if it's a fully insured plan, what they can do is, as a lot of employers are moving to higher deductible plans, you couple this with a high deductible plan, and the net savings there can be about 10 to 15% while giving your employees outstanding access to a personal physician.
Now, is health insurance coverage required with RHealth membership?
It's certainly not required, but it's highly recommended because folks, the human body is not a perfect system. As much as Dr. Stoll and our health physicians are able to focus on helping people stay healthy, some people do eventually get sick, and if you don't have health insurance and you do need to use a hospital or have some sort of major health issue, you know that can be very costly. So we highly recommend people to couple the direct primary care with some sort of wraparound health insurance policy, and there are options on that, but it's not required. We do have patients who unfortunately can't afford insurance, so they just have RHealth. But we recommend that everybody try to at least couple it with some form of insurance.
Right. So Mason, how would you say that RHealth is different from boutique or concierge medicine?
Well, it does share certain aspects with concierge medicine in terms of the quality of care and the access to the personal physician, but it differs from concierge medicine in two really important ways. Number one is typically concierge medicine, the doctors are still billing the insurance companies on a fee-for-service basis, and then they're just adding an access fee on top of that. So it's really just an additional access fee on top of fee-for-service insurance billing, whereas direct primary care, we're replacing the entire fee-for-service model with a very simple, affordable, fixed monthly membership fee. So that's the first way it differs. And secondly is just the cost. I mean, typically a concierge practice is going to be at least $2,500 a year, and this is obviously, that's something that the vast majority of people can't afford. This is just a much more affordable option to get great care for everybody.
Lastly, I just wanted to, for you to let our audience know, how could they get in touch with you?
Sure. If people want to learn more about direct primary care in general or RHealth specifically, you can visit our website, which is www.rhealthconnect.com, or email info@rhealthconnect.com, or call us on the phone the old-fashioned way, 215-600-4590.
Great. Now I want to thank you, Mason and Dr. Stephen Stoll, for being with us today and taking part in this interview.
Thank you very much.
Great. Thank you.